So I decided to do my process of change presentation on medication administration in an opioid crisis. The practice issue is pain management. In my opinion, I don't think pain management typically would be an issue. However, since we are in a major opioid crisis, then of course right now pain management is difficult to assess and of course manage. Um, One way that it can be an issue is when nurses or doctors have learned biases towards pain management, whether that has been learned through other employees, past experiences with patients, or if themselves or somebody that they know was once addicted, whether it to be pain medication or whatever it may be. So, my first discussion question is, what are some ways that you have seen pain management addressed in the clinical setting? Has it been negative or positive? So, personally, for myself, um, I've seen both. My preceptorship or my preceptor, whenever I was on N5G, she was very, I think, appropriate. Whenever she did pain medication, she would assess her patients, and regardless of, the physical signs that they may have displayed indicating pain or not, if they said it was a 10 out of 10, she charted it as a 10 out of 10 and got them their pain medication, and, didn't say a word. She educated them on the medication and what precautions needed to be taken, and then that was it. So I think she was very professional in that matter. However, I have seen some nurses who will are obviously biased, or they've had bad experiences with patients who are on pain medication or who've come to the hospital seeking pain medication. They'll make sly comments like, oh, they're not a 10 out of 10, or they're on their cell phone, how can they be that, or they're just here, they just want to get dope, or whatever it may be. So I've definitely seen both. I don't know if everybody else has seen both, but I know I definitely have. So I think the two QSIN competencies that pain management falls under is patient-centered care and safety. Definitely patient-centered care, because one of the aspects of patient-centered care is that you're individualizing your plan of care, and you're involving the patient. So if you were to take a patient who has appendicitis and has to have surgery and compare that patient with another patient, and you treat them the exact same way, you're not really individualizing your plan of care. Yes, they will receive a lot of the same medications, and yes, they'll probably have a lot of the same feelings. However, everybody's pain threshold is different. Everybody perceives pain differently. What is painful to me may not be painful to the next person. And there's a multitude of things that go into somebody having and experiencing pain. It just isn't the fact that they have a laceration on their leg or a cut on their arm. It's not unifocal. It's multifocal, and so that's why I think it falls under patient-centered care. I think it also falls under safety, because I'm not sure those of you who have been in a lot of pain before, but I know there have been a couple of times where I've definitely been in a lot of pain, and it's scary because you don't really know in my opinion, like, I didn't really know what was going on, and it was scary to think I was in that much pain. I feel like I was dying. And so if we're not taking care of our patient's pain and we're letting it, run out of control, I definitely feel like those patients feel like their safety is compromised, and they don't feel like they're being adequately taken care of. So that's why I feel like it also falls under safety. So my first article that I had found, it was titled Pain Management Practices and Perceived Barriers in Different Hospitals in Nepal. So they took a couple of different hospitals, and they asked patients, and they asked or not patients, sorry, they asked staff what exactly they felt like or what barriers they thought there were to pain medication, or pain management, I should say. So the main barrier that they found was that opioids are they're very strictly regulated. It's extremely hard to get them in that area. So they found that aside from being strictly regulated, the next main barriers were that there was a lack of knowledge on the nurses and physicians' side, there was not a high priority for pain medication. They placed that priority on other things such as airway, breathing, or circulation, and there's a lack of staff. So this particular quote says, the barriers that prevent pain management exist at all three levels: patient barrier, health professionals related barrier, and health systems barrier. And to overcome all of these should be given equal importance. So pretty much what this article is saying is that, yes, there are all these barriers and everything, but you're not going to be able to fix the situation if you look at one aspect of it. You have to look at everything: the patient's side of you, the health professional, and the health system. My second discussion question is, what are some perceived barriers to optimal pain management? Select all that apply. Lack of knowledge, lack of staff, cost, not considered a high priority, and they are strictly regulated. Since we just talked about it, I'm not going to answer, but definitely it was on the previous slide. How should nursing management proceed with change, and could management hinder or facilitate change? In my personal opinion, and from what I have found in the literature, is the most important way to proceed with pain management is education. From one particular article I found, Pain Management in Patients with Serious Illnesses, it suggested that physicians and nursing should start with a basic pain scale and then adapt that. So like I was saying earlier with patient-centered care, the nurses and the physicians from this article, what it's saying is that you should, use a basic assessment for their pain. Find out, what makes their pain worse, what makes it better, where is it localized at, or if it's not localized, if it's generalized, find out all those things, and then adapt your plan of care. Don't go directly, well, they have leg pain, and treat it the same way you treat every other leg pain. So pretty much the article was just saying that education needs to be given on exactly how to adapt those plans of care, plan of care, and how to change that. I thought this quote is from the same article, and I thought it was really important to include. It says, opioids are not always appropriate, but are still an important tool for managing pain. So yes, of course, we're not going to want to start somebody who has a headache, and we're not going to go ahead and say, all right, we're going to give you IV push Dilaudid. That's not going to be the first priority. But, sometimes it's definitely needed. Some patients need pain medication to get through certain things, and I definitely don't think anybody should be denied pain medicine. So I think that this quote is very important to remember in continuing on with our nursing career. So I found another article titled A Contextual Analysis to Explore Barriers and Facilitators of Pain Management in Swiss Nursing Homes. So this article, in my opinion, it was pretty fascinating because it was looking at pain management from the patient's perspective, and these were nursing home residents. So they were definitely in the older population. So from the article, there was 51% of residents that were reluctant to rate or report any pain. And many of these that reported pain, they refused to have pain medication. So the staff then would say, really it's pain medicine or that's it, because both the staff and the residents said that there was a lack of availability of non-pharmacological treatments. So pretty much those residents were either having to take pain medicine, or they were having to just go without. So definitely I think that this article really just shows the importance of the fact that there's a lot of people who don't want pain medication. They're only taking it when they absolutely need it. So there definitely needs to be more research, more education on ways to treat pain from a non-pharmacological standpoint. Another article that I found, this one actually, it was really interesting to read. It's called Effectiveness of an Interprofessional Workshop on Pain Management for Medical and Nursing Students. So they took medical students and nursing students, and they took some of the medical students, some of the nursing students, and put them with a interpersonal care team member. So instead of just receiving their education, normally they received it from an interpersonal care perspective, to try and enhance the way that pain was managed. So it found that medical students improved on their pain management skills, that they were more receptive to pain management or to patient statements of pain, and they were more, eager to help with pain management. However, it did not show that the nursing students had improved on their pain management skills. So the article pretty much just concluded saying that there needs to be more education and research done on this particular topic to see if there is a correlation between the two. Strategies to effectively implement this change. Like I said earlier, in my opinion, I felt like education was extremely important. And again, I think that education is definitely key to implement the change towards or implementing this in a positive way. The way that we can use education is educating both physicians and nurses on how to perform proper pain assessments and just making sure that we're getting those details for the patient's pain. A lot of times I've witnessed myself in the clinical setting where people will come in and just ask them if they're having pain. They don't ask them the characteristics of pain. And a lot of times, those characteristics that we're missing can tell us something about our patient. So I definitely think that learning how to do a proper pain assessment is important. And I really think that this next one, a lot of people fail to do. I know we've been taught it in school a lot, but unfortunately, I haven't seen a lot of people do this in the clinical setting, but education on when to recognize biases. There are a lot of biases that I have seen in the nursing profession, especially in clinicals, and so I think that education on how to recognize your biases is extremely important, especially with pain management. And also there needs to be education on how to individualize care. Just back to what I was saying earlier, that you don't need to treat every patient's diagnosis the exact same, because not every patient is the same. They're all going to be different. They're all going to have different levels of just management in general. And so I think we all need to learn how to individualize care. Education should also be given on how to reduce pain in other ways aside from analgesics. There was one particular article that I found. It was hard finding, honestly, it was hard finding articles on how to manage pain. Most of them were just on biases of pain. But this particular one, they took surgical nursing staff and they tried to see how relaxation techniques were utilized versus using opioid analgesics. So pretty much the article said that there were some patients that had a reduction in pain, but this was the first study of this kind, of the particular way that they did it. So they were just saying in the article that there needs to be more studies done on this. But mainly the important thing that I took away from the article was that continuing education for using relaxation techniques was definitely a way to improve the nurse's knowledge on how to take care of patients whenever they are having pain. So hopefully within the next couple of years there will be some more evidence-based practice come out that talks about relaxation techniques for pain management. So my last discussion question is, are there any effective pain management techniques that you have used or that you have witnessed in the clinical setting? In my personal opinion, I haven't really seen relaxation techniques. Patients who maybe have an exacerbation of COPD, they are taught pursed lip breathing mainly to help, keep the lungs open and help them, get in enough oxygen and decrease their anxiety. And if they are having pain, that can help some. But aside from that, I've mainly seen K-pads, which are the heating pads, and then ice packets used. I know I work right now in labor and delivery, and a lot of those mamas that come in and they are delivering, they'll have back labor, and so they'll use a K-pad to help with that. If they don't want an epidural, they'll try and use the K-pad, the warmth, to try and decrease that pain. And some say that there is some relief, and some say that there's not. But I don't know if anybody else has witnessed any of that. And these are my references.